Personality disorder is enduring, inflexible pattern of an inner experience and behavior that derives remarkably from cultural expectation and pervasive across the personal, social situation, being by the teenager or early adults, begins in teenager and early adults, remain stable over time and leads to clinical significant distress and functional impairment. So personal disorders are organized into three categories based on a shared clinical criteria. They are cluster A, cluster B, cluster C. Cluster A is a paranoid personality disorder, schizophrenia personality disorder, schizotype personality disorder. So cluster A personality disorder is paranoia, schizophrenia type personality disorders. Cluster B is an antisocial personality disorder, by borderline personality disorder, narcissistic personality disorder. Class C is the avoidance, is anxiety and fearful disorders. And cluster B is the dramatic, emotional, irritable disorder. So, general diagnosis features of personality disorder, it requires enduring pattern that deviate from the cultural expectations. This has to be deviated from the cultural expectation and is inflexible and pervasive. It's stable over time, and it begins when the person is teenager and younger adult. It causes functional impairment and significant stress. It is not better explained by other medical conditions or substance usage disorders or medical conditions. So type A personality disorder, paranoia personality disorder, features persistent disruption and suspicious. Interpreting others' motives as maleficent. So they think other people are malevolent, reluctant to the conflict with the others, bears guard, hypervigilant, so they are scared, hypervigilant, and patients are not psychotic. They are scared, they are paranoid, they are hesitant to engage conversation with other people. They think the other people are talking about them or hurting them, but they are not psychotic. They are not hallucinating or having a delusion or cognitive Their reality testing is generally intact, so they are not psychotic. Schizopersonality disorder features include the detachment from the society relationship, preference for solitude, isolation, solitary activity. They just want to do their own thing. They want to away from the society. They have a limitation emotional expression. They have little interest in a close relationship. They are scared of developing a relationship or having a connection with anybody. They are indifferent for praise or criticism. They don't care. They say, I don't care what other people is thinking of me. I don't care what other people is talks about me. So they want to protect themselves by saying that. But there is a personality disorder. Persons generally do not desire close interpersonality relationship. So interpersonal relationship, they avoid that because they are schizophrenic from their relationship. There is a schizotype personality disorder, and that is more anxiety, social anxiety, all the belief or medical thinking. They have idea of referential usually is particular in experience, from particular experience. Erratic, they have erratic behavior or appearance. Suspicious, they are suspicious. They are odd in speech. They have odd speech. They dress oddly. They consistent part of the schizophrenia spectrum, but without the persistent psychosis. They don't have psychosis, but they have odd speech. They have idea of reference. All the odd beliefs, they believe something odd. Magnetic thinking, unusual perception, experience. Erratic behavior or appearance, they dress different erratic way. Cluster B personality disorder is antisocial personality disorder. It requires the person to be 18 years or older with the evidence of conducting disorders before 15 years. So the symptom begins before 15 years. And it's characterized by the impulsiveness, aggressiveness, irresponsibility, lack of remorse, reckless disregard for safety, psychopathic. They have a psychopathic symptoms or psychopathic features with antisocial personality disorder. For borderline personality disorder, the feature is I despair. The symptom is I despair. Identity disruption, they have identity disruption. They have disorganized affect. They have disorder, affective instability. They have chronic feeling or emptiness. They have suicidal behavior or self-injury. They have paranoia and that stress-related paranoia. Abandonment fear. They have a fear of abandonment. They have rage, inappropriate anger to the situation. Relationship unstable. They have a relationship unstable. So the first line of therapy is a deductible behavior therapy. Medication is used only for target specific symptoms if the patient is complaining about anxiety or depression, only for that symptoms. No medication is appropriate, especially for borderline personality disorder. Hysteric personality disorder symptoms include core features include excessive emotionally, attention-seeking behavior, dramatic personality or presentation, rapid shifting of emotion, anger, happiness, suggestibility, inappropriate reductive behavior, and inappropriate seduction behaviors. Narcissistic personality disorder core features is grandiose. They are grandiose. Need for admiration, lack of empathy. My gosh. Lack of empathy. Explosive relationships. Envy of others. The envy of others. Fragile self-esteem beneath the grandiose. They are grandiose, but they cannot deal with any criticism. They are the perfect for their eyes. For cluster B personality disorder, they are avoidant personality disorder. They avoid the society. They have social inhibition, feeling of inadequate. It's opposite of the grandiose. They have sensitive to the criticism. They desire relationship but avoid them because of fear of rejection. Differential from the psychopersonality disorder is the avoid wanting relationship but fear of rejection. Psycho is lacks a desire for relationship. Psychopersonality disorder, they lack the desire for wanting a relationship. They don't desire relationships, but for the cluster B, they are scared. They are not lacking the desire, but they are worried from the rejection, so they avoid. Depending on the personality disorder is dependent. They depend on others. They have excessive need to be cared for. Difficulty making decisions independently. They depend on others so much. Fear of separation. cleanless behavior, difficulty, excessive disagreement, difficulty expressing a disagreement. They cannot disagree. They will agree anything and everything, so they can be inclusive. OCD features include obsessive compulsive personality disorder, include perfectionism, excessive devotion to work, devotion to work, they work to death, need for control, rigid and rituals, preoccupied with rules and orders. I remember people I work with that have these characters. The causes epidemiology of these personality disorders include personality disorder is a 1 to 3% for general population, antisocial personality disorder is a 2% or more, 1 to 4. Narcissistic personality disorder is 2% or more. Avoidance is between 2 to 3% of the general population. Obsessive compulsive personality disorder is a 2 to 8%. Personality disorders are common in psychiatric disorders and primary. So the risk factors of these personality disorders include family who have the personality disorder, childhood trauma can develop personality disorder, abuse or neglect is the risk factor, insecure attachment when they were children is one of the risk factors, genetic vulnerability is the other risk factor, emotional dysfunction, emotional dysregulation is the other risk factor, advanced childhood adversary childhood experience is other risk factors. So you want to assist the patient with these symptoms. First, you want to assist developmental history. How do they develop when they were younger? Do they have anything that caused them to develop this? Do they have a neglect, abuse, trauma in their children age? So developmental history, you want to assist that. Relationship pattern, you want to assist the relationship pattern. Occupational function, are they working? Can they work? Is this affected their personal function? Work, school, relationship. You want to assist drama history. If they have drama history, if they had a substance usage, if they are using now or they have a history, impulsiveness, suicidal ideation, aggressiveness, harm to themselves or to others, legal history, if they have been legal troubles, if they are alcohol, if they have been in prison, family, you want to assist the family psychiatric history. You want to also assist the personal trait across the multiple setting. How do they perform? Do they have this personality disorder in different settings, in school, work, and at home, or it's just situation cause this. Also, you want to use the mental status examination to assess and evaluate their appearance, their behavior, their speech, their mood, their affect, their content, their thought content, thought process, insight. Do they have insight in their situation, judgment, impulsive control? You want to consider a differential diagnosis that it could be, and that is differential diagnosis that you want to consider are bipolar disorder, major depression disorder, anxiety disorder, PTSD disorder, ADHD disorder, schizophrenia, spectrum disorder, substance-induced disorder, neurocognitive disorder. The treatment include psychotherapy. Psychotherapy is the first line of the all personality disorder. For evidence-based practice, deductible behavior therapy is the best evidence for the borderline personality disorder, chronic suicidal ideation, self-injury behavior. Cognitive behavior therapy is useful for avoidance personality disorder, OCD personality disorder, maladaptive cognitive pattern, multiplication-based therapy or MPT improves the emotional regulation, interpersonal function, and attachment. Transfer focused psychotherapy used for borderline personality disorder. Schema therapy targets long-standing maladaptive schemes. Chronic personality difficulties. Pharmacotherapy not indicated. No medication are appropriate, especially for personality disorders. If there is a mood disorder or depression disorder, SSRIs are the first line, and SSRIs is treatable and may improve if the person complains about anxiety, depression, OCD features, mood stabilizer if the patient is impulsive. Mood stabilizer may reduce the impulsiveness, mood instability, aggressiveness. Examples will be lamartine and fulbrite. Second generation antipsychiatric medication may consider and may reduce the cognitive perception symptoms, anger, severe impulsiveness. Use caution and only when indicated for psychiatric medications. You want to also assess the suicidal risk, especially in the borderline personality disorder. You want to evaluate suicidal ideation, previous attempt, self-injury, substance usage disorder, protective factors. You want to assess if they have a protective factors, access to lethal means, and then you want to also prognosis. Better outcome are associated with early diagnosis. Prognosis are better outcome are associated with early diagnosis, consistent with psychotherapy, stable therapeutic alliance, family support can improve the outcome, treatment compliant can improve the outcome. Many patients experience a significant improvement over time, particularly those with borderline personality disorder who engage the evidence-based psychotherapy. Psychotherapy is the cornerstone of the treatment personality disorder. Deductible The dialectical behavior therapy is the first line of treatment for borderline personality disorder. Do not diagnose antisocial personality disorder before age 18, and evidence of conducting disorders before 15 years old is required. Distinguish obsession, impulsive, obsession, obsession, compulsive personality disorder from OCD. They are different, they are not the same. By determining where the symptoms are egocentric or ego dystonic. Egocentric or ego syntonic, ego syntonic or dystonic. That's how you differentiate between OCD or obsession compulsive personality disorder. Do not diagnose unless you differentiate that. Avoidance personality disorder is characterized by a desire for relationship despite the fear of. Avoidant personality disorder is characterized by a desire for a relationship despite the fear of rejection, where the schizo personality disorder is characterized by indifferent for close relationship. Patients with borderline personality disorder have a increased risk of suicidal ideation and recurrent self-injury, and require ongoing safety assessment. Thank you for joining me today. Please subscribe the channel and join me again. Give me feedback, write your questions, write if you want to see me do or talk about topic that you are interested on. I can cover it here. Thank you for joining me again.